All right, thank you, Dr. Decker. So what I want to do is talk to you about, if we get the slides up for everyone to see here, talk to you about what we're trying to achieve here today, a little bit of structure of the day. As I said, this is our 9th annual meeting. Today is about you, all of you, certainly the patients, but also beyond the patients, there's the family that support the patients that go through the journey together. There's the caregivers, the friends, the loved ones. Truly, every member of the team is important because you are on this journey together. And so some of the topics we're going to talk about today are really about the entire group going through this journey together. We cannot overlook the importance of the entire team, of all the people that are supporting you, the patient. Because really, as physicians, as healthcare providers, we recognize the value of the support that you get, and we recognize the importance of taking care of the caregivers, which is certainly a focus of ours as well, of how we can provide you that support. So some of the topics today are going to talk about that. Many of you may have already seen this, but I think it's very important to talk about this for the cancer patient and to keep this in mind. It's a poem by Dr. Robert Lynn. He says, "Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot eat away peace. It cannot destroy confidence. It cannot kill friendship. It cannot shut out memories. It cannot silence courage. It cannot reduce eternal life, and it cannot quench the spirit." The reality of a cancer diagnosis is difficult. There's no question that amongst all the various diseases and afflictions that we suffer in human life, cancer holds a particularly terrifying spot in the human psyche. It affects patients in ways that other diagnoses don't. You know, you tell someone they have heart disease, you tell someone they have hypertension, diabetes, it's not quite as terrifying as being told you have cancer. And yet we know you can live well with cancer. We know people can survive. We want to focus on living rather than on just talking about the tumor, on talking about the cancer, because you can still have a life. And the people in this room know that. You all know this, that you can thrive, you can survive, you can live well. And that's why the topic of this conference is living with cancer, and how do we achieve that? This slide comes from the American Cancer Society about cancer survivorship, the sheer number of Americans who are currently surviving with cancer. You know, you are not alone. Here in the state of Arizona, and this is 2016 numbers, there were over 350,000 cancer survivors in the state of Arizona. This is a nationwide problem, and we all know this, but these numbers, they keep going up. They keep going up because the aging population, as the baby boomers hit the Medicare age, then of course cancer rates go up because cancer is a disease of aging. But there's also the fact that our treatments are better. We're detecting cancer at earlier ages. We're more successfully managing it. We're curing more patients than we ever have before. And what that means is there's going to be more cancer survivors. Every year, this number is only going to increase. If we look at it another way, amongst men, there's over 3 million men living with a prostate cancer diagnosis, 3.5 million women with breast cancer. And then, you know, these are 2016 numbers. You could look at the rest of the diagnoses here, you know, where you might be on this chart or your loved one. But by 2026, the estimate is that there'll be 20 million, over 20 million cancer survivors in the United States. So we're here to talk about caring for the whole you. And you hear this a lot. I mean, I think we all understand this at a certain intuitive level, that caring for a patient goes well beyond just caring for the disease. But of course, it's the challenge of understanding all those issues, of thinking about all those issues, and then trying to create an infrastructure and a method by which to provide for all of these needs. Treating the disease is really only the start. As I say, we're talking about living well. So diet and exercise remain fundamentally important, and you'll hear about that today. Certainly mind and body health. We do not discount the importance of the psyche in the cancer journey, in health maintenance in general, well beyond just cancer. Spiritual health, of course, the role that spirituality and religion play in our lives is part of good health and living well. Relationships, again, in this aspect, not just talking about the caregivers, but talking about how the patient or the person who is afflicted relates to the people around them, their spouse, their partner, their family members, their friends around them, the people at work, because cancer can affect all of these things, and knowing or having some construct for how do you maintain these relationships and not let them be altered by a cancer diagnosis is part of living well. Caring for the caregivers, again, much of the strain of a cancer diagnosis also falls on the loved ones, on the caregivers. And we recognize that. It's certainly something we talk about in clinic. It's something that everyone, the families, are well aware of, and it's something that at times will be at the fore of the conversation, but oftentimes will fade into the background and can be overlooked. And we really want to try to avoid that. We want to make sure that this idea of caring for the caregivers is always part of the conversation. Education. Clearly, that's part of the purpose of this meeting today, is to help educate you. And that's something that happens, of course, in every appointment, right? We're talking about your disease. We're trying to empower the patient to understand what is going on and give them the tools to manage every aspect of the diagnosis and how it's impacting their life. Mayo has always been committed to education, whether it be seminars like this, whether it's the interaction in the clinic, whether it's publications, information on the web, other teaching forums, the medical school, School of Nursing, all the other ways in which we try to disseminate information. One of the conversations that often comes up in the cancer clinic is people are wondering if there's something that we have hidden, something that they didn't hear from their previous physician. And the answer is we don't hide anything. Mayo Clinic exists to improve the care of all patients everywhere. So many of you in this room are our patients. Some of you aren't, and you're attending the conference. And the fact of the matter is, you are our patient. Whether you come to the Mayo Clinic or not, whether you receive your medical care elsewhere, our commitment is to advance medical care worldwide. We disseminate, we share our knowledge as quickly as we can. We're not trying to hide anything. We want to move cancer care forward. Without any question, the daily commitment of every physician you're going to hear today is to eradicate cancer. That's what we're working towards. And that's eradicate cancer for everyone, everywhere. So even if you're not one of our patients in the clinic, as I say, you are our patient, and we're very happy that you're here, and we're committed to helping you. And then creating a better future, as you're going to hear about today. As everyone knows, clinical trials are critically important to cancer care. It's education, it's research, it's never giving up on the idea that as far as we have come in medical science, as many awesome achievements have been achieved by our predecessors, it's still not enough, and we will never stop pushing, relentlessly pushing, to create a better future and to advance the science. And this is just a quick look. This is about over a year old now, but this is at Mayo Clinic, Arizona. Over 230 providers who spend a major portion of their time specifically on cancer care. And the only point I'm trying to make here is to have you realize how big the team is, how diverse the team needs to be to attack cancer. This is just the list of the physicians at Mayo Clinic, Arizona, who are involved in cancer care. But of course, there's all the other members of the team. There's the nursing staff, the social workers, the nutritionists, our yoga therapist, acupuncture, all of the laboratory techs. The janitors who work in Mayo have a critically important role, and they understand this. So the team that is here for you, the AV tech sitting here in back, our social media, folks, the team that is dedicated to this is all here for you. All right, so a word on our program. In the morning, as I say, we have our lecture series. Some of these will be talks. The second one is a panel discussion. There are breaks throughout the day. Back up here. Oops. Sorry about that. There are breaks throughout the day, so we'll have a couple of coffee breaks. I'll be introducing people as we walk through. Lunch is from noon to 1. It's a beautiful day, so it should be outside. In the afternoon, then, we have our breakout sessions. And sorry, I'll let you do it. In the afternoon, we have our breakout sessions where it'll be tumor-focused. The breakout sessions, you certainly can attend any one you want or multiple if you'd like. It's very much open for patients to come in and out, all of you to come in and out. For the genitourinary session, we will be splitting it up. As those of you who have attended over the years know, prostate cancer will be the kind of dominant theme for most people. So the first hour will be focused on kidney cancer and bladder cancer, and then the second half will be focused on prostate cancer. And then at the end of the day, we'll have our integrative therapies and support breakout session. So throughout the day, please feel free to approach us over the breaks, over lunch, or at the breakout sessions with any questions you might have. And finally, now I want to acknowledge our sponsors. Of course, the JW Marriott is very generous in supporting this conference, but also then the sponsors listed here have given financial support. As you know, there's no registration fee for this meeting. We very much intentionally design it that way, but these things do, of course, take some money to pull off. So special thanks to Amgen, to Pfizer, and then to Genentech as well. And then our exhibitor, I'm sorry, there was one more slide. Our exhibitor from Genomic Health, you'll see their table out there. Special thanks to them. And thank you to all of you. Thank you.